I had polio in 1950 when I was 4, the acute polio. Really was aware of developing post-polio symptoms in about 1985. Although they've been coming on for a while before that. Post-polio syndrome, there isn't a diagnostic test per se, so it's what we call a diagnosis of exclusion. People may have one of the following 3 symptoms: increasing weakness, which then results in decreasing function, musculoskeletal pain, and people who were old enough to remember when their acute polio say it feels a lot like the acute polio, mostly really achy, like sort of overuse kind of things, and unexplained fatigue. People will say they suddenly get to a point that at 2 or 3 in the afternoon it feels like they hit the wall and just can't take one more step or do anything without stopping to rest. It happens in about 40 to 50% of polio survivors, and happens 20 to 50 years after the onset of the acute polio. Part of the diagnostic criteria is that there needs to be a period of stability of at least 15 years. And then it usually has a fairly insidious onset, although it can have a fairly acute onset if people have had a major stressor, either psychologically or physically. Now, it's a slowly progressive disease. The best studies are looking at muscle weakness, and it's about 1% per year loss in muscle function. 1% is not enough that most people notice it. It's sort of then after 5 years or 10 years, 5 or 10% is noticeable. I tell people it's like as you're starting to need bifocals. You keep adapting and adapting until finally one day you say, oh, I've got to get bifocals, but it's just because your arms aren't long enough anymore. And it's sort of the same of you can keep adapting, making minor little changes until finally you can't. And the treatment, there isn't a curative treatment. So I tell people, having grown up in South Dakota, that it's like keeping the old combine or the old pickup going another season or 2 with bubble gum, baling wire, duct tape. There are a lot of advances in bracing. There's, and certainly now, powered mobility equipment, scooters, wheelchairs are better and the world's more accessible. So there are a lot of things people can do to still be living a full life. But it won't kill you. I mean, the only time it potentially is life-threatening is if people have severe respiratory problems from the breathing muscles being affected, or severe swallowing problems from the swallowing muscles being affected, and they don't address that. So they have swallowing problems, they get food, liquids down in their lungs and cause pneumonia, or they just get so they're not getting enough oxygen or blowing off enough carbon dioxide. There started being some stuff in the media initially in about the mid-'80s that there might indeed be such a thing. Prior to that, polio survivors who'd been noticing increasing fatigue, increasing weakness, were just told they were getting old. But some of them that were only in their 40s said, I'm really not that old. The treatment, well, primarily in the 50s, late 40s, early 50s, was the Sister Kenny, which was hot packs to help with the muscle spasm, and then also a lot of stretching to prevent some of the contractures and some of the deformities. But there wasn't it is a viral illness, so there wasn't any treatment then, and there still isn't if somebody got polio now, as they are in some parts of the world. There's still not any curative treatment. We don't have an antiviral against the polio viruses. The main place where it caused its damage was in the anterior horn cells in the spinal cord, which are the nerve cells that go out to the muscle and tell it what to do. So one of the things that's unique about polio survivors is they still have sensation. They still can tell whether the bath water is hot or cold. They can feel if there's a rock in their shoe, as opposed to people with spinal cord injuries or whatever that don't have any sensation. And because of the sensation and because of proprioception, they can tell whether their foot's flat on the ground or whether it's at an angle. They can walk and stand with amazingly few muscles just because they know how to balance everything and know where they are in space. Then originally they used to say it affected muscles that weren't affected by the initial polio, but it's a little naive to think that the virus that circulated all in the spinal fluid all up and down the spine and around the brain really just affected like my left leg. And so most of the time if you really look at people closely, and particularly with EMGs, you'll find that there was some damage other places. But if people had a little damage to a muscle in their thumb, but total paralysis of the leg, nobody noticed that. Definitely the people are not contagious. They aren't going to give polio to somebody else. Although there is a researcher in Italy who has found fragments of the polio virus in the spinal fluid, the blood, the tissues of people who are having post-polio syndrome. The challenge with his research is that he doesn't have enough people who had polio and aren't having new problems to identify whether there's a difference between those people and the people who are having new problems.
What it was?
Yes, yeah. Some of the bracing is way better. It's lighter. You know, people who had polio remember the metal and leather, and a long leg brace could weigh 10 pounds, which if somebody already has a weak leg, it's a little counterintuitive to think that that the treatment would be adding 10 pounds of weight to that leg. So they're lighter. They are making some advances. They've made a lot more advances in prosthetics, and some of that hasn't. It's just now starting to carry over into the orthotics, the bracing. Back in the 50s, the whole emphasis in rehab was just do more. Come on, one more repetition, and if you work hard enough, you can get rid of your braces, wheelchair, whatever. So there was a real strong work ethic. And probably we overshot that. And some of the initial thought about post-polio was that it was all overuse. And some of it probably is overuse. So
people over-exercise.
Right. So, if somebody has a weak leg, and I've had a few patients who have a weak leg and are still trying to, train for a marathon or the boulder or whatever, and that's probably not smart. Initially when post-polio was first sort of identified, people said, oh, it's all overuse, and so just sit in your chair and don't do anything. Well, obviously that's not good for the rest of your health, for your heart, and you gain weight, which then puts more stress on the leg muscles if you have weak legs. So the current thinking is somewhat modified. If you have a weak leg, you probably shouldn't be running or doing a treadmill, but using a bicycle, particularly with some hand stuff, or a rowing machine, or swimming, or whatever, is still a good thing to do. Trying to keep somebody's weight down is good, because particularly if they have weak leg muscles, for every pound you gain, the muscles have to work, generate 3 or 4 pounds of pressure. The current recommendation is that people do a little more protein, just in terms of if you aren't eating enough protein, then your body gets the protein from your muscle, and you don't need it to sort of destroy some muscle just as a source of protein. Rotary International had as a goal that by 2005 they would have eliminated polio in the world, which was their 100th anniversary. It didn't happen, but in Rotary we say we're this close. In actually 2014 there's more cases than there were in 2013 because of some of the unrest in Africa and some of the other issues. The current thinking goal is to try to eliminate polio by 2018. From the World Health Organization, to say that it's eliminated, there have to be no cases identified for 3 years. So I don't think we're actually going to make it officially from the World Health Organization by 2018. It is preventable. You know, the challenge in most of the countries is either social unrest, political unrest, or for a while in the Muslim community there was some teaching that this was, and because the push has been from Western people, that this was a ploy to decrease the population of Muslims, and so some of the folks were told that if their children got immunized for polio, then they would not be able to have children, they'd be sterile. That's getting turned around, but and I actually heard an interview on NPR a while ago about in Pakistan that they've had a real big push because polio is still endemic in Pakistan. But they need so much else in their health system too, that actually some of the people in the health ministry are saying, you know, we have so many other needs, and this now is a relatively small need compared to some of the other needs. And they were sort of annoyed that they still were really pushing. You know, that polio was getting all this publicity and stuff, and their other problems weren't, which is not totally unreasonable. When we were using the oral vaccine in the United States, about 8 to 10 people a year got polio from the oral vaccine. About half of those were kids with immune deficiencies, and about half were grandparents, aunts, uncles, parents who'd not been immunized, and when their child was immunized with the oral vaccine, they shed some live virus in their stool, in their bowel movement for 2 to 3 months, and they got it that way. But the youngest person one of the last people in the United States who got it from the vaccine I've met, he's probably in his early 20s now. So the younger people generally, I assume, got it in other countries and then immigrated to the United States. We do not use the oral vaccine anymore because in the United States we decided those 8 or 10 cases, when there were 20,000 cases a year or 50,000 cases a year, as a public health issue we said 8 or 10 cases is acceptable when we're preventing 19 or 49,000 cases. When polio was so effectively eliminated with the vaccine, we said, no, 8 or 10 a year is not acceptable. So in the United States, we're back to using the killed vaccine, the shots, the Salk vaccine. In other parts of the world, they're still using the oral vaccine because it's much easier. It doesn't take trained personnel to administer it. Well, the biggest question as I see patients is, and I do still see patients, is, how bad is this going to get? So I say, it's obviously individual, and with my cracked and cloudy crystal ball, here's what I think. But the other is people are really frustrated that their physicians and their health PTs, whatever, don't know anything about polio now. And that's a good news, bad news situation. The good news is that the polio vaccine was so effective that they don't see it, and they have a small number of patients who have polio-related problems. The bad news is that for the polio survivors that are still here, trying to find somebody it's hard to find a physician now who knows how to prescribe a brace, or just some support, or this is going on and I don't know what's happening, or maybe I'm not able to work anymore. How do I get on disability? But there are 26 post-polio clinics in the United States. And there's a directory published by Post-Polio Health International that's based in St. Louis. It's the main organization. And the website is www.postpolio with a hyphen between the two.org. I think it's the most balanced information, but I'm probably a little biased since I'm on the board of directors. They have a directory that lists all the support groups that they know of around the world, but especially in the United States, all the post-polio clinics and any health professionals that have an interest or an expertise. We just, in August, had our first Colorado post-polio wellness retreat. We had 53 people. none from South Dakota, but from 19 states. And it was a 4-night, 3-day experience, and was just a lot of people had never been around anybody else who had polio. There was lots of good energy. I know of at least 4 or 5 people that made some real positive changes during that time, and we had a good time. At our retreat, there were 2 young women. The ages ranged from 36 to 85. The 2 youngest women, the 36-year-old and one in her early 40s, had both gotten polio in India and then had been in orphanages and adopted by American families. And they actually live within like 10 miles of each other, but they'd never met each other. So they just had a lot of sharing of common experiences.